Thank you for joining us. My name is Steve Petty. I'm the Executive Vice President of the Lynn Institute. Thank you for joining us for our second community update. I want to turn it over to our President and CEO, Karen Waddell, for a couple of words.
Welcome, and so good to see you. Thank you for all you're doing. Thank you for all you're going to do as we all build and grow during this incredibly unique time. I was reminded as we've gone through the days, and I think I learned something new every day, not only about myself, but my memory of my childhood when we didn't have all the things that we have today. And I kept hearing that my parents talk about World War II and how they, the day that President Roosevelt was on the radio declaring this day will live in infamy. It was about the terrible, horrible, heinous attack on Pearl Harbor that directly attacked specific people, specific Americans and military Americans most of all. And how I watched my parents, of course I wasn't alive during World War II, although my staff thinks I was born during the dark ages, but I wasn't, guys. But anyway, as I look back on that, and I know that generation, and I watched our generation overcome the Oklahoma City bombing and 9/11, and how, although we hated those times, we came out of it so much stronger and better. I'm just so encouraged by what we're gonna do and what we're learning during this period. Each of you are such important leaders to your families, to your organizations, to Northeast Oklahoma City, to our city and our state. And I want you to know how important your work and your attitude is during this time. I've been inspiring myself, but not only, I think most of you, many of you are faith people, so you're getting your encouragement through scripture and through other ways of worship. But in addition to reading inspirational and remembering some of those quotes from our great leaders, I pulled up one today that I kept hearing, when the going gets tough, the tough get going. And I thought, well, who said that? Well, that quote is attributed to all people to John Kennedy's father, Joe Kennedy. And you get a couple different dates when he might have said it, but it looks like it was during the Depression and then after World War II, and how the country had to rebuild. And so we think about that, and then we think about our leaders today, wonderful people like our very beloved Martin Luther King, who said, we must accept finite disappointment, but never lose infinite hope, which takes us right back to where we are. Everyone in this organization and on this call has been reminded of how important hope is to us through the wonderful writings and preachings of our great Chan Hellman. And as we listen to Chan Hellman, and he talks about defining hope, that it's the belief that our future will be better than today and that we have the power and the abilities to make it happen. And he also goes on to say that hope is the single best predictor of our ability to thrive. Well, I absolutely know that this group is doing good things, going to do great things in spite of some really difficult challenges ahead. I thank you so much for all of that, for being on the call, for all your sharing and doing. And I would remind you, to paraphrase this just a little, that when the going gets tough, the tough get going, and the tough always have hope. So thanks for joining us today. We've got much better people than I to speak to us, and thanks staff for putting all this together. And I know Anthony's going to mute me right now. Thank you.
Before I turn it over, Anthony, I wanted to tell you just a quick update about what Lynn's been doing in Northeast Oklahoma City. I think most of you know, and a lot of you are our partners out there, we have been working to get grant funding to help with food distribution. And we were just at New Zion last Saturday helping Pastor Scobie and Pastor Kenneth and Nikki Nice give out, I think, to 270 families, just grocery sacks full of great fresh foods and canned foods and everything. We're also trying to work to get household items. Those are few and far between, as you know, and the people in Northeast Oklahoma City are having a rough time getting a hold of some of these resources. So Lynn is committed to working with our partners and working to assist those folks in Northeast Oklahoma City. We are also, you guys might know, with the task force, Nikki Nice's task force, we also have a food resource page that I think Arthur Younger is going to talk about in just a minute. But make sure you go to northeastokcfood.com. That gives you all of the resources of all the food distributions and such, and kind of what's going on with the coronavirus and the latest updates. Also, as Karen mentioned, Chan Hellman and his book, Hope Rising, we have been doing just really quick videos that you can see, and we'll be sending those out, some new ones, to talk about hope during this time, hope and grief, hope and faith, and all different types of hope. And that's what Janine and Anthony and Angela and Steve Haynes, all of us here at Lynn have been working on. So enough about me. We've got a lot going on and would like to hear from you as well. I'm going to turn it to Anthony to get us started. Thanks.
Yeah, to piggyback off of Karen and Steve, we're so thankful and for you guys joining us. We have a handful of you all who are going to give quick updates. I really would encourage you, as those of us are giving updates, to utilize that chat feature. If you're on your computer, you can see it at the bottom, to ask questions. I'm going to do my best to, following the update, to pose those questions to that speaker. And if not, I'm going to follow up after this conference to make sure that we can get those questions answered. So I see we have Arthur Younger with the Regional Food Bank of Oklahoma on with us. I wanted to toss the mic over to him to see if he can give us a quick update on how things are going for them.
Good morning.
Good morning,
Can
Arthur.
you hear me?
Yes, sir.
Yes, sir. I will not be sharing my photo today. My video today. I have a lot going on at the house, and it is a mess. So, but it's good to see everybody. Quick update as far as the Food and Resource Center project goes. Everything is still going with that. Advisory committee is still meeting and strategizing on ways to, establish the organization for the FRC. The board of directors will actually have their first official meeting this afternoon. So things are still moving forward with that. Of course, we just had to make adjustments into, like we're doing here with conference calls and things like that. So we're still moving forward. Everything's still moving forward with that. In regards to Food for Communities, which is the department that I am, and we are still supporting, of course, our partner agencies, Northeast Oklahoma City. We have a lot of confidence in those groups. We may have a couple of closures here and there, but they're not permanent. It's, basically, a closure for a week or two, just something temporary to kind of get restructured and get back reorganized, deep sanitizing and things like that. But overall, as far as the partner agencies we have going in Northeast Oklahoma City, we still have a strong group there, and majority of them are still open, taking on additional days, adding additional services to clients in need, and things like that. Food for Kids program, they are still, of course, supporting the local pantries, the feeding sites, the backpack program and things like that. As far as the food bank goes, we have, of course, just like everyone else, adjusted in regards to having staff take on different roles, with us not being able to have the public come in and volunteer and things like that. So we're helping out where we can. People who are generally working from home, of course, going out to the More Food and Resource Center. And then the staff that is still essential as far as being at the food bank. They're helping out there with packing boxes and things like that, but still providing support and communicating to organizations like you guys, just to make sure Northeast Oklahoma City has everything they need and everybody's working together.
Yeah, well, Arthur, thank you. I know you, as well as a lot of our partners and organizations doing work, are doing really good things, and so we're thankful. As you guys have needs, please let us know how we could help or how we could pass the information on to those on the call, or those who may not be in the call but are also partners. So thank you so much for that update. I didn't have any.
I will say that the one thing that is kind of a catch-22, because we do have agencies that have expressed needs for volunteers, but then some of course are needing volunteers, but afraid to let people in that they don't know, in fear of contamination, things like that. So if you guys hear of groups that are just looking to help, whether it's picking up at a site, stocking shelves, packing boxes and things like that for agencies in Northeast Oklahoma City, just let me know. and I can get them linked with those agencies that's asking for volunteers.
Okay, yeah, yeah. And what we'll do is, if you have any connections of that sort, you can send me a direct message on here, send me an email, and following the call, we're going to put together a list of notes. We'll make sure to get that ask in there or include those additional resources. That way we can get you connected.
Okay,
yeah,
thank
so
you.
include that. Is there anything else you'd like to add to that?
I believe that's it.
Okay. Well, Arthur, thank you so much. I really do appreciate it. I hope you're keeping your sanity in these times. I know you've got a lot going on, and I know for myself, seeing these four walls so much is every now and then I've got to walk outside and get some fresh air. So thank you so much, Arthur. Next, I want to welcome Blair Shobe over at the Area-Wide Aging Agency. Him and Allie Wallace on the line to give us an update on their work and how things have been going for them. Do we got you guys unmuted?
Well, you tell me.
Well, I can hear you coming through. And then Allie, we'll get you unmuted here in a second. So yeah, Blair, whenever.
Alrighty.
You're good, yeah.
Well, thank you. It is, been looking forward to this, and it is so good to see so many longtime friends and coworkers and fellow workers in the vineyard as part of this as well. Anthony and Steve asked if I would give everybody just a brief update as to what Area-Wide does and how we can work together in the work that you all are doing in Northeast Oklahoma City. Area-Wide, just as a few quick words of background, is a local nonprofit. Our main mission is to administer programs that are funded through the Federal Older Americans Act. And those are the programs that I think we're going to want to talk about and look at how we can get more people into them. The biggest thing that we do across the board is provide food. And food comes in two different forms. One is through our congregate meal sites. Northeast Oklahoma City has two sites. They're both closed right now because of the pandemic, but we're counting hopefully a short number of days until they're reopened. One is at the Northeast Community Center. The other one is at the Temple Gardens apartment complex over by Holy Temple Baptist Church. And on any given day, about 100 people will participate in the meals at those sites. Right now, everybody that was going to those sites on a regular basis is receiving the food delivered to their homes. That's how that's going to work until all of this comes to an end. Because this is a federally funded program, there's a lot of different ins and outs that go along with it. One of those are the nutrition requirements of the food themselves. These are highly nutritious meals. They are certified by a registered dietitian. They maintain a 1/3 balance of the RDA and a minimum of 600 to 700 calories per meal. That's what everybody tells us the seniors need. Because everything is kind of in this very iffy stage right now where our ability to move about in the community and getting people to do the things that they normally do, the meals are transitioning a little bit as well. Rather than hot meals, we're now delivering a lot of either frozen meals or what are called shelf-stable meals. Our friends at the Regional Food Bank know what we're talking about, but that's food that doesn't have to be refrigerated and can be kept on the shelf for a while. Not anywhere near as good or as fun, but it will keep you going. As part of the federal disaster funding that's coming forward, we've already received a 22% increase in federal funding specifically for food, which has already gone out to all of our meal providers. That is specifically designed to increase the number of people who are being served. And this is where we really do need to be working together. We have a lot of capacity then to take on more people. The basic requirement for us right now is that a person has to be 60 or older. And under this emergency situation and the requirements of these emergency funds, there's really not much else that has to be met in those regards. So as you all know of people that you would like to see get into this program, we ask that you call our office at 942-8500, and we'll get the process started. We will take it from that point.
And that was 9428500, just so I can make sure I get that down accurately.
You got it.
Okay, yeah.
We do anticipate there'll be more federal funding coming in our direction, but we don't know how much, when, or what it will be specifically used for. But at the point we start learning that, I'll communicate that to Anthony so he can get the word out to everybody. We also provide transportation services. A lot of the senior transportation programs that Embark currently is running, we fund. We're picking up the tab for that. We're also getting some additional allowances that will help us use Embark even more than we are now. Arthur, we got permission yesterday to actually use Embark to deliver the meals that the food bank is putting together. That way we can keep our friend Marilyn whole as she goes about doing her task. Some of the more sundry things that we do as well, and probably less on point while we're working through this pandemic, is we fund legal aid for services to seniors. And right now they have turned their focus towards working with seniors who have been affected by the economic chaos that's going along. So if there are seniors who have lost their job or are facing eviction because of all of this, they need to be referred directly to legal aid right away. The sooner they can get to work, the better off the senior will be and the more likely they'll be able to be helped. We also have funding that comes from sources other than the federal government. And one of the biggest comes from the Masonic Charitable Foundation of Oklahoma. And we're able to use that funding for really some things that we enjoy quite a bit. We work very closely with Rebuilding Together for home repairs and the installation of wheelchair ramps. We're able to buy hearing aids, eyeglasses, and dentures with this fund. There's been recent research that shows there's a direct correlation between untreated hearing loss and the onset of dementia. And so that's a very particularly important thing that we're doing. We do that work through the John W. Key Speech and Hearing Center down at the OU Health Science Center. We could also provide dentures and eyeglasses, and we have some funds that are available for utility assistance. Everything that we're talking about can be accessed through one phone number, through one portal, and that's 942-8500. Like all of you, we're kind of having to plan on a couple of different fronts. One is how we react to the pandemic, and that's for us is a very, very fluid situation where things are changing day by day. But two, also starting to look forward towards when things start to resume and what we have to plan for in order to pull that out of the ground. So Anthony, that is the 40,000-foot perspective as to what AreaWide does. Just so everybody knows, these services are available in every part of our country. I have 621 peer organizations around the nation. We all do basically the same thing. It may look and sound a little different, but it's still the same range of services. So if you want, I'd be glad to take some questions.
Yeah, are there any questions? I know the one and you mentioned Embark getting that green light to transportation. And so will that be directly to deliver directly to seniors?
Hello.
Yes. That's the goal right now, is to get all of the food delivery programs to where the senior does not have to leave their house. One thing that we've observed that all of our clients are minding very, very well, and they're fully socially isolating, so they're not getting out. So any of the stuff that they need has to be taken up to their doorstep.
Yeah, Blair, I'm seeing a question about volunteers, and I'm wondering the same things. I'm about to hop on a call to propose various opportunities for organized volunteers or skill-based volunteers. Do you need volunteers in that space?
You know, surprisingly at the moment, and I almost hate to say this, but we seem to have all the tasks covered. part of what we've had to do is redirect some of the staff to other things than their normal routine, so we can keep them on the payroll, quite frankly. But between our contract providers and our friends with Embark, everything right now is getting done. But at the point that that might change, I certainly know how to find Anthony.
Another question we have from Florida Pope is this for the seniors on the Northeast side of the OKC only, or is this a wider service for those outside of Northeast?
This is for all seniors in our 4-county area. But one of the requirements of the Older American Act specifically is that there be an emphasis put on both low-income seniors and on minority seniors. And that's what we do. Our numbers in those areas are very strong, but now that we have more resources than we've ever had before, we need to be looking for additional participants.
Yeah, that's great.
Mr. Blair, I have a question, and this is Nikki Nice. Hello, everyone.
Hey, Nikki.
My question to you is, I received an email from Hunger Free Oklahoma, and they were talking about the fact that they only had 8 participants registered for the Meals on Wheels. Have you all talked to each other to cross-reference some of those seniors that you may have?
You know, Nikki, I'm not sure what to tell you in terms of them saying they only have 8. We actually fund Meals on Wheels in the program at St. Luke's for, we specifically fund them to work with churches, to find churches who are willing to take this on as a mission, to both prepare meals and to deliver them. The numbers that they're giving us is that they've seen an increase of over 300 people needing food assistance since the pandemic really started on March the 11th.
Yes, well, I understand that, but I guess the need as far as folks signing up for in the Northeast quadrant for them, it hasn't increased. So I'm curious to know if you all where we need to focus maybe our efforts to ensure that we get all of our seniors connected to this service.
Well, I think it would be appropriate, Nikki, that we invite the Meals on Wheels team to participate in all of this. I had not heard anything that kind of broke out their numbers regionally. When this group took over, they've only had the contract since last July. And the group that their predecessors really had not done very much in the previous couple of years. So we've talked with Meals on Wheels about putting a strong emphasis on some of the lower income parts of town, including Northeast Oklahoma City. But I'll reach out to them and find out what's going on and see if they can provide some additional details, and I'll get that to you directly.
Thank you so much.
Yeah, thank you, Blair, for your update. I didn't see any other questions come in. If you have any related to what they have going on, please reach out to Blair or Allie over at Area Wide, and or you can shoot them to me, and I'll make sure we get those questions answered and as quickly as a time frame as we can. Next, I do want to, Dr. Lund, if you'll allow me to, move to Daisy over at OKCPS. She does have a time constraint, and I really wanted to give her an opportunity to update us. Obviously, most of us, if not all of us, are aware of the new normal that is virtual learning with education. And so I wanted to give her an opportunity to tell us or give us an update as to how that has been going, and provide us with any information that they have as far as what their needs might be.
Hello. I'm sorry I had to head out early. I have another meeting. But yes, I want to thank everyone for the work they're doing in the community. Without everyone, I don't even want to see how it would would be. But yes, OKCPS started the continuous learning packets, and we had an opportunity the week before we launched these packets. Teachers were calling students, and more than anything, just for them to make a connection and to see how the students were doing, what kind of resources they needed. And we had great feedback from a lot of teachers. They got on those calls. A lot of them finished within a day or two. So we're very fortunate to have great teachers in the district that care about their students and that genuinely miss them. So with that call that the teachers made that week, before the continuous learning packet was released, we got information from students on technology, what kind of technology they had at home, if they had an internet connection, devices, and we were also asking students if they would prefer, since they don't have technology or a device, if they would prefer paper packet. And that gave us an idea of how many packets we were going to print. And we were overwhelmed with the amount of people that picked up a packet that first Monday, the Monday, I think it was the 6th, Monday, April something. That first, the 6th, April 6th, we had an overwhelming amount of people pick up. So we had to do an emergency printing session. And right now we're releasing around 27,000 packets. So that means at least half of our students have a paper copy of their continuous learning plan for that week. And teachers continue to make phone calls, and they're setting up Zoom classrooms for their students that do have technology. They're on the phone with others that don't. We're trying to figure out, I think there's 5,000 families that we haven't been in contact with. So we're kind of going out of the box and trying to figure out how we can connect with families. So it's just a struggle, but our teachers are doing everything that they can to maintain that connection with students. But we've only heard positive things. If you are in the community and you hear of other comments or recommendations, suggestions, please send them over our way. We would love to see how that's really going in the communities, and see if we can make some changes for the following weeks. But overall, it's great. Teachers receive tutorial on how to help students virtually. Students are receiving a weekly update from someone, a video, just to kind of walk them through their packets and how to get more resources and how to ask for help. It's kind of a gist. It's a lot.
Yeah, that's great. Are there any immediate questions that maybe we might have regarding Daisy's update? Daisy, thank you so much. I know I totally get it. There's a lot going on, and so thank you so much for giving us your update while you could. If you guys have any questions regarding what OKCPS is doing, I'm sure Daisy will be glad to answer them. You can shoot me an email, or between now and the end of the chat, if you put it in the chat, I'll be sure to get those questions to her. That way we can try to do what we can to get them answered. So Daisy, thank you so much. I do now want to circle back to Dr. Charles Lunn of Centennial Health. We're so grateful for him to join us today. I think we've still got him on.
Yes.
You are.
Yeah, you unmuted me. I felt very stifled. Hello.
Yeah, thank you so much for joining us. We're glad to hear an update as to how things are going for you.
Well, I'm in Centennial, and we do primary care on the northeast side, basically 23rd and Rhode Island, northeast Martin Luther King. Things are going really, we're getting prepared for the onslaught. We've slowed down. We're not seeing chronic care patients as much. We're trying to make them be safe at home, but we're getting really prepared for what we're going to see. Obviously, if you look at other cities, the population that basically dies the most is the people located in Northeast Oklahoma City. And we can go through all the reasons for that, and everybody knows those. But the biggest thing is prevention. If I could just employ everybody to go ahead and make sure that people have prepared their homes for if somebody's going to be sick, to make sure that they have a sick space or a sick room. One of the things that was a little disturbing to me, I looked at the CDC website about how to prepare your house if you get sick. They assumed everybody was like me and I have 3 or 4 bathrooms. A lot of people in Northeast don't have 3 or 4 bathrooms, so we really need to work on the education of how to prepare to get sick, and people need to prepare if they have to leave the home. We just finally had one employee come in that we're not quite sure if she's safe. So anyway, does anybody have any questions for me?
Any questions at all related to Dr. Charles Lund? And I know that this is are you testing at Centennial is a question we just received.
We are not testing. That's going through the city county. There's more tests than there was, and they've changed restrictions so you don't have to have a physician referral. We are getting. We've had 2 or 3 of our patients be tested and have come back negative so far.
Yeah. Thank you so much. Obviously, it's a fast-moving environment where things we have suggestions one day that may change, and so there's a lot going on. So thank you so much.
Okay. Well, I'm gonna get off the call and go back to work.
Okay. I hear you. Thank you so much for your efforts.
Okay. Thank you.
All right. And I did see. As we continue to have questions come in, I'll take those questions and get them to those who are given the updates to make sure that we can get the full circle and get those questions answered. So thank you guys so much. Next, I want to see if we could get LT Knighton with the Oklahoma City County Health Department to give us an update. I know that, like many of you, she's got a lot going on these days. And so LT, thank you so much for being with us.
Sure.
We are glad to hear from you and to see how things are going for you in this time.
Yeah, can you hear me okay?
Great.
Okay, perfect. Thank you. Sorry, I had some technical difficulties and had to move to someone else's office, so I'm a little frazzled this morning. But thank you guys for having us for an update. And I am so sorry that Dr. Mack couldn't be with you all today. As you can imagine, it's just a little nuts here, and he gets pulled in a lot of different directions. So we just appreciate the opportunity to give you all an update, and I'm so glad that I was able to hear about some of the great work that you all of the LIHR partners are doing to meet the needs of our folks during this pandemic. It's very important. So I thought I would just kind of give you a quick try for a quick 5-minute update, but then be available for any questions that you all might have. And Anthony, please stop me if someone has already reported some of this to you all. I don't want to waste your time, but a couple of the things that I want everyone to understand about how the response to this pandemic has unfolded here in Oklahoma County. Our epidemiologists began investigating travelers from international countries in early February. So we've really been at this for quite some time, well before the city and the governor, put in some of their shelter in place or safer at home initiatives. We've been working in the community out, talking with, doing contact investigations, trying our best to stop the spread of this virus in the community. And so since early February, we have done contact investigations on approximately 3,800 individuals here in Oklahoma County. And it's important to remember that number and that work, because I'm going to tell you a little bit about why that's important when I close. So as all of you know, we opened our testing site March 25th. We have tested approximately 2,000 individuals as of yesterday afternoon. That number continues to grow every day. We have a hotline, as the doctor just mentioned. We did open up testing to anyone with symptoms last Monday. And when that occurred, we began to see 600 plus callers a day calling in, looking for appointment times. And so as you can imagine, or as you probably have read in the news, testing supplies continues to be an issue from day to day. There are certain days when we have plenty of a particular part of that test, and then other days we might be missing a different component. And so that's one thing that I think it's very helpful for the public to understand. And as much as you all can help us with that messaging, as people want to be tested and need to be tested, we just all have to understand and embrace that it's not a perfect scenario right now. In a perfect scenario, we would go out and test every single resident of Oklahoma County. But at this time, we're only able to test those who are exhibiting symptoms. I want to touch quickly on, I think someone mentioned it earlier, the impact that the virus is having on African-American communities in other metropolitan areas. We are definitely watching those numbers closely. Here at OCCHD, our epidemiologists began pulling data on the 19 deaths that we've had just here in Oklahoma County. And I can tell you that three of those 19 were African American. The majority of the deaths and cases that we're seeing in Oklahoma County right now do happen to be within the Caucasian male group over 65. But we all know that's just today's data. And so we want to definitely do our best to make sure that we don't start to see the types of numbers in the African American community that some of those other cities are seeing, because as we all know, and as the doctor referenced just earlier, African Americans are more vulnerable to this particular virus due to the fact that individuals with underlying conditions do have a tougher time with their immune system has a tougher time fighting off this virus. And we know about all of the underlying conditions that plague particularly the African-American community, like diabetes and heart disease. So it is critical that we keep an eye on that data, and particularly testing and making sure that when we are able to expand that testing capability, we do have some measures in place to reach the African-American community. And so we're talking through some of that right now, whether it be mobile testing, drive-up testing to where we can go out in the community versus the community having to come to us to be tested. So those things are in the works. I had a great conversation with Counselor Nice yesterday afternoon. I think we're going to try to put together a small sort of task force, if you will, of folks who are interested in wanting to help in this topic and wanting to be engaged in getting the message out, particularly to the Northeast community, about how this virus can significantly impact them and what they can do to both prepare themselves and to prevent this virus from impacting them and their families. Quickly want to just touch on a few other things that we're doing that some of you might not be aware of. So with the hotline that receives 600 plus calls a day, the day after we launched that, we realized back when we were taking doctor referrals that there's a lot of our community that they don't have a primary care doctor, right? And so we partnered with Variety Care so that we could make sure that the uninsured folks in our community had some place to go to get a doctor referral if they were exhibiting symptoms. And so Counselor Nice, shout out to her again. She and Mary Mahoney offered up to provide transportation for folks who receive appointments for testing but may not have a way to get out to the state fairgrounds. So those two partnerships have been critical in our work, particularly reaching the Northeast community. We are engaged in quite a few efforts that I will take a lot of time going into today, but whether it be working on the governor's task force related to hospital surge, we've been working with OU and Howdy Reeves on possibly identifying a location that we could help them with for med surge capacity. Homeless Coalition, I know there's a lot of work around that. There's talks of us providing some testing to take out to some of the homeless shelters to test folks who might be symptomatic. And so a lot of those things and discussions are happening every day. But a couple of important notes that I wanted to leave with you all today and really encourage you to share with your organizations and with the residents that you're in daily contact with. Number one, we're hearing a lot of reports of folks who are essential workers, whether they be grocery store employees or transit workers, whatever it might be. Folks are still requiring doctor's notes or testing results for people to come back to work, and the CDC is strongly pushing against that. We at Oklahoma City County Health Department are strongly urging businesses to stop doing that. So if you hear of people saying, you know, I had COVID, I've recovered, my employer won't let me come back, they cannot do that. So make sure that you are encouraging folks to remember they don't have to have a doctor's note. If their kid has a fever and the pediatrician is saying you need to keep your kid home isolated for 14 days, that employer cannot require a doctor's note while we're under this emergency pandemic. Social distancing and physical distancing are still going to be key, particularly, again, as we go back to the conversation around this virus, particularly impacting African-American communities. We know we don't have a cure. There are different, medicines and pharmaceuticals that are being researched, but there is no, one item cure, if you will, for this virus at this time. We don't have a vaccine. So all that we have as a tool at our disposal to protect ourselves against this vaccine is physical distancing. And so we've heard reports of funerals still taking place and people, having large gatherings, particularly right here in the Northeast community. And that's one of the reasons I reached out to Councilor Nice because we realized that we want to ramp up some of that messaging for the Northeast community so that they understand that this can and will impact them as well if we don't take those physical distancing measures seriously. So making sure that we're just continuing to talk about that. And one thing too, there's been some great, I guess some good news reported recently about our hospitalization numbers not really rising in the past week or so. And while that's really great news, it shows that our physical distancing work is paying off, that all of us are doing as individuals. That could change in a minute, right? I can tell you all that we have heard reports and we've had pictures sent to us of people, meeting at Easter and, large family gatherings and things like that. I can tell you that makes us nervous. We are definitely afraid that the Easter weekend could potentially see our case numbers spike here in about a week and a half. So we'll know, here in about a week and a half to 2 weeks, whether or not people really follow this physical distancing measures over their Easter weekend, but it is that critical that we not let up on the work that we're doing, because that kind of hospitalization rate that we're seeing kind of plateau right now, it could go up in a moment's notice if we don't continue to do what we're doing. And so on that note, I know there's probably a lot of questions around, I know you're probably seeing national media and the Western state governors are banding together to create an economic, reopening the economy plan, if you will. President Trump has his own ideas about reopening the economy, as I'm sure Governor Stitt does as well. But what I want to close with, as I talked about the contact investigations earlier, that our epidemiologists have been doing since early February. In public health, we know that whether or not, social distancing starts to ease and businesses start to reopen, restaurants start to reopen, whatever that looks like, our work will still be extremely critical in doing contact tracing. Just because we reopen society doesn't mean the virus is going to stop, right? And so it's going to be important that we continue that contact tracing work. We're going to be putting out some press releases this week so that the public starts to understand why contact tracing is another tool, if you will, in our tool belt to fight this virus, because as we reopen society, we know that people are going to continue to get sick, and we want to make sure that we are separating those folks and testing those folks and isolating them away from the general population, so that we don't have continued outbreak. So again, I'm not a politician, and I, don't aim to say what politicians will or won't do come May 1, but just know that the virus will still be here. The virus doesn't know an end date, right? And so I would just encourage all of us as individuals, whatever happens May 1, to just keep mindful that the virus is here and protect ourselves. Last thing, and then I'll stop rambling, Anthony. While we're in this pandemic, our Northeast campus is still open. Our clinic is still open. We know that other ailments don't stop, right? Just because we're in a pandemic. And so it's important that folks who do have underlying health conditions, diabetes, heart disease, whatever it might be, that they continue to take care of those health needs that they've been living with well before this pandemic. And so we want to encourage people, call your doctor. If you don't have a doctor, Health Alliance for Uninsured, we've partnered with them. We have their clinics on our website. Make sure that individuals are still taking care of those health needs that are going to still be here long after the pandemic is gone. Immunizations are still key, particularly those childhood immunizations. STD testing is still important while we're in a pandemic. So that's the last thing I'll leave you with, and I'm happy to take any questions.
Yeah, thank you so much, LT. That's a great update. I know there's been a constant curiosity for the best way to continue what we're doing. So thank you for that bit of information. What we can do is, if you guys have questions, I don't immediately see any related, send me an email or put them in the chat, and I'll make sure I follow up with LT. And we can get those answered to the best of our ability. So LT, thank you so much. I really appreciate it. And next, Karen, do you have a question?
Yeah, yes, LT, thank you so much, and thanks everybody at the health department for all they're doing. Do you have a feeling for whether or not the people in Northeast Oklahoma City need masks? Do they have masks for the population? Do you have a feel for that?
Karen, I don't, and that's a really great question. Thank you for asking. I would definitely look to you all. If you have any insight on that, let us know. We do have some, we ourselves here at our campus have just started wearing masks as of last Friday. And so we definitely, we are already receiving donations from various groups. And so if there is a need in the Northeast community, we would be happy to be engaged in leading that effort to get masks out. I heard recently that the Thunder organization, I believe that they're making thousands of masks that they are going to start giving out to the community. So I can let Dan Mahoney know, if he hasn't already been working in the Northeast community on that distribution, that he should.
Yeah, we heard it.
Thank you again, LT. I really appreciate it. If you continue to have questions, please let me know. I want to let you know, I want to be respectful of your time. If you have to go, please feel free to go about your day and do what you have to get done. But if not, we have a couple more updates that we're going to have. But please don't feel the pressure that you have to stay on. Obviously, we'd love to keep you in the loop. Next, I want to see if we have him on the line, Dr. Kersey Winfrey with SSM Health. Are you on the line?
Yeah, I'm here.
So thank you for joining us. We'd love to give you some time to update us on how the response and how things are going for you and your work.
So just a broad reflection, this is an unprecedented time in all of our lives. I can't recall ever dealing with anything like this in my professional career or personal life. And we're a community that's resilient. We've dealt with weather disasters. We've dealt with domestic terrorism. So this is really something that is unsettling. I would just echo the last presenter and say that this is something that is not going to go away tomorrow, not going to go away in 2 weeks. The reason why we blunted the curve and will likely experience far less crisis than other communities in our country is largely because we have followed all the measures that we know work against a contagion like this. But that only means that we blunted the curve, and it means this thing's going to be around for a while. So our lives will continue to have workarounds. Our professional lives will continue to have workarounds. And that's particularly true in healthcare. And the last thing we want is a second peak, which, let me give you a little armchair epidemiology. There's a website, actually it's a YouTube video called Simulating an Epidemic. I would encourage all of you to write that down and then go out and look at that 20-minute video, and you'll begin to understand, or you'll have a better understanding, number one, as to just how contagious this pathogen we're dealing with is. It's got an R0, or a contagion factor, that's, depending on who you listen to, 80 to 100% greater than the flu. And then you figure into it its virulence factor, which basically the mayhem it can unleash on people, particularly people that are vulnerable from other health issues. We have a really, really bad combination. But that video will help you understand better just what factors we can do and should continue to do to protect all of us in the community from this infection. Another website I want to point you out to is the Oklahoma State Health Department. There's a section called Executive Order Reports. And as the health department has kind of circled the wagons and gotten its act more and more together, they've actually have a robust data set out there that really kind of hits head on a lot of the most frequently asked questions around testing, just who's affected by this, what counties are experiencing on a county level. A lot of data that I can help you understand the impact it's had on the state of Oklahoma. And then some of the resources and things we're currently doing to as mitigation strategies. The last website I'll point you out to is the IHME predictive model. This was built out of Washington State. It is kind of one of the largest public service, I think, tools I've ever seen in terms of how comprehensive it is. It provides a prediction model that has been the basis for a lot of the planning for many states. A lot of the prediction came from the experience in Washington State, with which most of you should remember that was the first community hit really hard with this. A lot of nursing homes were affected. And really the community experienced a substantial surge in patients that has reproduced itself all around the country and is predicted to reproduce itself all around the country. And of course, the index hot zone of the world is New York City, where they have had just a horrible experience with this. So in Oklahoma, we have in excess of 2,000 cases reported, 108 deaths, 488 in the hospital. The infected are in 64 of 77 counties in Oklahoma. I work in a integrated delivery system in central Oklahoma and have basically been in pandemic mode at the hospital for well over 5 weeks. Prior to that, SSM as a system, delivery system, began watching this in convened incident command the second week in February, understanding that this was forecasted as being just exactly what it's turned out to be, a global pandemic. A lot of that activity has been around staying rooted in our mission, which is through our exceptional healthcare services, we reveal the healing presence of God. The highest priorities are to protect the health of the patients in our community, to continue to maintain the integrity of our health system and prepare for a surge in patient and be ready for that, and then probably first and foremost protect the frontline staff, and that has been again a significant challenge. It's something that that based on the overall limitations that we've had in some of the personal protective equipment early on, some of the access to testing, it has really been a challenge. I can tell you, looking back over 5 weeks of readiness activity, we've made considerable progress as it relates to access and procurement of personal protective equipment. We have system procurement, we have the state stockpile. The strategic national stockpile kind of is another source of consumption, actually, as it turns out, for our state. But all that being said, there's a lot of spot buys as well, is what we call them. Those are vendors that kind of come out of nowhere that actually have large one-time offerings of N95 masks and various other equipment that are necessary to prevent infection. I can't really at this time speak to any critical shortages, but we are very, very, very tight stewards, as are all the delivery systems within our community, of personal protective equipment. I have a forum where I meet with my contemporaries from around the city, and we're all dealing with common problems. We're all dealing with things very similarly in terms of our preparedness plans. A lot of what we do was built around multiple calls to action. Obviously, as a hospital of our size in our community, it's a very important part of our mission to be there for people. And as we move further and further into this, we've shifted away to a continuous focus on just how do we get ready for the onslaught of patients predicted for the hospital. So just to summarize for you, many hospitals are dealing with shutting down usual business activities. Elective surgeries, for example, have been put on hold. A lot of the ambulatory clinics have been throttled down and consolidated to sites that allow them to operate more efficiently. The number of visits and access for people to primary care services have become limited, although we've been able to restore a lot of that through telehealth services. Within the hospital, the activities that we have worked on have included cohorting the units within the hospital. We've shut down multiple units so that we can commit as much space as possible to patients affected with COVID-19. That includes an incredible amount of intensive care real estate as well as equipment, anticipating that many of these people have pneumonias and respiratory failure as a significant complication. We've had to redeploy staff from some of our units that have been closed down. We've had to retrain to different job skills. We've had to utilize medical specialists in different ways. For example, the anesthesiologists, without there being surgeries, have been redeployed to manage ventilators and provide intubation services. We've also had to cross-train a lot of other non-professional staff to really staff the care teams we've had to create to be prepared for the anticipated surge in patients. If you look at that IHME model and take a retrospective look, the curve, the expected mortality curve, the expected prevalence curve, and demand on hospital beds and space has diminished considerably. The governor's plan for surge was that each hospital present to him a model that would show how we would deal with a 40% increase in the demand for hospital beds. Those numbers are just astounding when you look at them. we have continued to prepare for the worst, understanding that the curve is blunting, and while the worst may not happen, we still have, for reasons mentioned by the prior presenter, we still have risk. And similar to the prior presenter, Ms. Knighton, I was unsettled yesterday just observing the amount of traffic that has gotten back out on the roads. And so I'll just close this off and leave the floor open for questions just by saying we can't declare victory with this thing yet. We have to continue to remind the community, and we have to stand united as a community and adhere and deal with the sacrifices that are necessary to protect the community and make our future better. It's not going to end overnight, though. It's going to require that we continue to follow all the social distancing, stay at home, meticulous hand hygiene, containment masking. Those are all some of the principles that will get us through this an intact community. So with that, I'll just stop for questions.
Question: what's your overall feeling as how we're doing as a state?
I'd have to say that as a state, we enjoy the advantage of having a low population density. So I try to remind everyone of that opportunity. That's an opportunity they don't have in Manhattan, for example. So for us, that means social distancing will be extra effective. We have places to distance ourselves to, if you think about it in simple terms, whereas if you get to the very population-dense areas, they don't have that advantage. So I think the overall timing of the directives, and more importantly, while they were soft directives, the overall, I think, collaboration as a community to adhere to this as much as we possibly can has made a big difference. And again, I'll come back around to the discussion that Dr. Lund had referenced regarding some of the vulnerable populations. And I would say that in other areas are places where, again, because of suburban crowding, where that problem is really magnified, the problem that some vulnerable populations have in dealing with these and preparing for some of these precautions are really, really limited. And again, that's something that we have to work with, and I know that's part of our Healthy Communities initiatives, but it certainly is a different lens that we're looking through things now because of the overall vulnerability of people.
One last question I have for you is, does Saints have N95 masks for patients and families?
So the N95 masks are protective masks that the staff wear to protect themselves when aerosolization of body secretions are creating particulates that can be inhaled. Generally, for patients that are in situations where we're protecting them, they are shrouded or covered much differently. So patients that are affected, we have them wear masks so that they don't transmit. Patients that we are trying to protect, we don't take them anywhere close to areas where we know we have infected patients. So we are cohorting and keeping that distance there. I think one of the misconceptions that people have about masks just fundamentally is that a mask will protect you under all circumstances, and the reality is that mask may actually predispose to infection if it's handled too often or if it gets soiled with viral particles or viral matter. So it can kind of become a carrier if we're not meticulous about how we handle the mask. The containment masking by the recommendations by the CDC are interesting because it's a full turn 180. The CDC was, not advising masking or universal masking just simply because of the things I mentioned to you. It doesn't protect that well, and it may actually increase risk. But the CDC, under the reasoning that there are people who carry the disease without symptoms, reason that if anyone that goes out in public could be that asymptomatic carrier and therefore should wear a mask. And so it's called, I call it containment masking, because all of us are wearing masks when we go out to keep, if we are silent carriers, it keeps us from transmitting the infection. So the overall assignment of masks to staff in the hospital is built around whatever exposure risk they have. So there's different levels of mask. N95 is the top or the highest integrity mask in terms of protecting against aerosol, or just simply put, when people are coughing, or when you're doing procedures that create a lot of viral particles and aerosolize them. Majority of the transmissions with this virus are by contact. In other words, you might cover your cough, but then if you take the hand that covered the cough and touch a countertop, that virus can persist there for hours and days, depending on whose studies you look at. So if someone then comes along and touches the same countertop, scratches their nose, they've inoculated themselves. And that's what's scary about the virus and how it's transmitted, because we don't have markers to show which tabletops have actually been soiled and which ones haven't. So anyway, there's a lot of stuff that we're learning as we go along. It's a good question.
Yeah. Well, Dr. Winfrey, thank you so much. I know you've got a lot going on, as a lot of other partners do. So thank you for taking the time to give us an update.
Certainly. Call me anytime.
Will do. Will do. You might regret saying that, Dr. Winfrey.
Hey, I look forward to getting our team back online.
Yes, sir. Yes, sir. So if you have any other questions for Dr. Winfrey, please put them in the chat. I'll make sure I follow up with them afterwards, or send me an email, and I'll do what we can to get those answered. Our last updater is Miss Councilwoman Nikki Nice. Councilwoman, we're so thankful to have you on the call with us, and we're looking forward to hearing how things have been going and what you've been seeing and hearing in the community.
Oh, well, first of all, thank you all for the opportunity to listen in and hear what's happening in your respective areas and groups. And thank you all for the hard work and commitment to the Northeast community and really just to our city, because if we can uplift Northeast Oklahoma City, we're truly uplifting the city as a whole. So thank you all. I also want to commend all of the physicians and everything that we've heard thus far, because right now we are truly in crucial times, and especially with the giveaway that we had Saturday. While it was a wonderful, wonderful occasion, there were so many volunteers up there. It scared me to death because we had too many people there, and we can't tell folks to stay at home and social distance or physical distance if we're not doing the same and we're trying to assist folks. So I just want to stress that we must continue to spread that message of physical distancing and social distancing. And one of the things that obviously I just found out myself for the numbers for African American community, I had heard that we were 7% as far as our deaths in Oklahoma, but just one is too many. And the reason we must continue to spread that message of folks staying at home and at least getting that information out is so we won't get into the same conversations that we've seen across this nation with other African American communities, because obviously we're looking at social factors, what's taking place, redlining, environmental factors. So these are things that have been underlying for our community for years. And obviously these are the same things that are impacting us now, which are making us the first to go in perspective of how this virus has been able to just take over in those vulnerable communities. So while we're testing fully across our county, we're only doing that testing at the drive stations. It has been a commitment of mine to ensure that people who need access have access. So we do have those vehicles in place right now. And I know LT didn't mention, but we're working to get online for OU Science Center, as far as OU Medicine for them to be a testing site. I'm not sure how long that's going to take, even as you heard with the testing materials not being fully adequate for even state testing. So that's probably going to take a little time, fortunately. And we're also looking at seeing how we can get testing as far as maybe a remote testing site for the Green Pasture Spencer area. So we do know that if people need transportation and they're out in that area, we can make sure that they get it to get tested. So right now, we just want to continue to spread the message that there are opportunities for folks to get transportation if they need to get tested. So I do want to make sure we spread that message. If nothing else, there are vehicles in place for people to get tested. And that's been the most important thing for me, to just ensure people have access. As we're also looking at just minority health in general, this is Minority Health Month for Oklahoma, for just the nation, Minority Health Month and Black Maternal Health Week. And when we look at even what's affecting our communities, the infant mortality and maternal mortality for African American moms, it's definitely a factor as we are looking at what we're doing right now in this virus and how it has been able to take over in our communities. I have been receiving quite a bit of information from folks who have resources, so I thank you for those, and I'll continue to share them on my social media. I did receive information from heyneighborokc.com, and they reached out because they are a grocery delivery service and they want to support seniors and highly at-risk people during this time. So if you know anyone that can benefit from these resources, they have a number 252-1011, or maybe we can figure out get some volunteer services to assist them in their efforts of what they're trying to do. As you did hear as well, we were able to get about over 270 people drove away or walked away with some grocery, fresh produce, and that was the key. And special thanks to Reverend Cheryl and Pastor Scobie, and also to the Lind Institute, because I just made one phone call to Reverend Cheryl. I said, "What do you need?" And he told me. I said, "Okay, let me make a couple phone calls." And I called Miss Janine, and she was immediately on it. So I truly appreciate her. She's a jewel. And she donated material that she had at home. And my mom cut it into bandana sizes for folks, and we had hair ties to go with them to ensure that folks who were there, at least, and they needed to make a mask, they could. So we were able to do that. But I know that's just a small fix. But we just have to continue to spread that message of hope. And if you watched, I watched my own message from Miss Oprah yesterday about our communities and how they are being affected, especially in Chicago and in Milwaukee. This is happening swiftly in our communities as far as those deaths, because as soon as we think it's a cold, we think, oh, we'll just wait and go to the doctor on Monday. And there was one gentleman, he passed away within a week, just 3 days in the hospital. So this is something we just have to get in our communities, get out of that mode of not wanting to be seen or go to a doctor. We just have to continue that message of hope for them. So those are just a few things that I have. We'll continue to keep everyone updated as much as possible, and I appreciate the opportunity to be able to speak with you all today. Thank you.
Councilwoman Nice, what have you seen in terms of the need for masks Northeast? Do people have adequate masks, have masks at all? Or are you seeing that a lot of people are still in great need of masks?
I think people still need them, but here's the problem when we're looking at masks and wearing them in the African American community. We don't want to wear them because we're already seen as inferior when we wear a mask. So it's difficult to get folks to want to wear the mask because we don't know what the outcome could be because we're wearing it. So the best thing, I try to ask folks if they need one, if they want to wear one. I think the most thing we can do is just make sure our seniors have one, if nothing else, if we can't get those young people one. I have had a lot of asks for masks for kids. And I think that's one thing we should definitely focus on, especially with our kids in the Northeast community that are facing asthma, and the ones who have to get out with their parents because that's that's their only parent, and even the generational families that we have staying in one space. We have to just get those masks to them. But right now, I haven't had a lot of asks as far as masks, but I know they are needed, and I think that's I don't know who's asking who for them, but I would like to figure out if we could get a central area number or just a website for people to be able to get informed and know that there is a way for them to get a mask. And also, thank you all to Lim Institute, this will be my last comment, for the information we were able to put in those grocery bags with information about COVID-19 for everyone who needed them. And someone asked for the website, it's heyneighborokc.com. That's the website, but we were able to get that information. And maybe one thing we can do is get those posters. I would like to figure out how to get those posters into our convenience stores, because that's right now where people are probably going if they have to go anywhere in the area. Maybe if we can put them in the small box discount stores for now, and those places people are going to pick up items, so they can have that information, and maybe we can include mask information on that, just that one poster to give information for those who need it in our community to know there are resources right now.
Yeah, well, thank you so much, Councilwoman, for what you're doing and being a part of this call today and giving an update. I know there's a lot going on, so thank you. I want to say thank you to all of you for joining us today, and I want to let you know that as we continue to work with you all and our other partners, the northeastokcfood.com website and Northeast OKC Food Facebook page is where we're putting out a lot of the food distribution information. And so look to those resources as we continue to put that stuff out. If you have updates or resources that the community could benefit from, please shoot myself or someone on our team regarding what you have going on, and we'd love to get that information out. So thank you guys so much. It's great to see faces and to hear from you all. And so stay healthy as you guys continue to work together to fight against this pandemic. And we wish you all the best of health, and do well as you continue to do what you're doing.